My name is Dr. James, and today I'd like to share with you a topic entitled Causes of Fluid Buildup in Our Lungs. You see, you may suddenly feel or experience shortness of breath, or maybe when lying, at night on your back, you may feel uncomfortable, have some difficulty breathing, or when you're doing something very active, lifting something very heavy, or doing anything that is physically demanding, you be short of breath, and your heart may be pumping, or beating very very fast. Some individuals may also experience some chest tightness, or some people may cough, and the cough may, they may come out with some frothy mucus. When I say frothy mucus, it's some bubbly or foam like with a pinkish sting. Some individuals may also experience some wheezing sounds. I mean, some wheezing. They may be wheezing. It means some rattle sound in their breath when, when they breathe. Uh, some may also feel anxious or feel restless, or all the time experiencing tiredness or fatigue. To greater extent, some may have what they call the swelling in the legs or feet, and you may experience some rapid weight gain. All these are symptoms or indications of buildup of fluid in the lungs. But what are the causes? We have two main causes. We break them down. Medically, we call actually buildup of fluid in the lung. We call that pulmonary edema. So we have the two main categories: the cardiogenic pulmonary edema. It means it's related to the heart. It means here specifically heart failure, congestive heart failure. The left side of the heart, or the left heart, is weakened and it cannot pump blood well. And normally, if the left side of the heart cannot pump blood well, fluid or water can fill up your lungs. This is 70% of fluid, or cause of fluid buildup in our lungs. The second cause is the non-cardiogenic pulmonary edema. It means it's not connected with the heart. And we have a condition called adult respiratory distress syndrome. What does it mean here? This is caused by severe infections suddenly. It's acute condition, or it could be caused by pneumonia or trauma, or pancreatitis, that's inflammation of the pancreas. Sometimes it could be liver disease, or bleeding or swelling in the brain. We call that neurogenic pulmonary edema. Some individuals may be taking some non-steroidal anti-inflammatory inflammation drugs like ibuprofen, that is a painkiller, or some may be taking beta blockers, or calcium channel blockers like blood pressure medication, or medication for angina, that's a pain in the heart, or heart failure, or post-attack medication for post-heart attack, or to prevent migraine. All these can contribute to buildup of fluid in the lungs, actually. So they are all under adult respiratory distress syndrome. This is 15% of a contributor here. The third cause here is kidney disease, or chronic kidney disease, or kidney failure. That can also lead to buildup of fluid in the lungs. The last one here is high altitude. Suddenly you are exposed to a high altitude environment that you are not used to. That can also lead to buildup of fluid in the lungs. As you listen to me, you may have issues with the heart problems, or whatever underlying issue. A call away, and your life will never be the same. If you're calling outside the UK, it's +44 738 464 7300. If you call it within the UK, it's 0738 464 7300. Thank you for listening to me.